Good vision is a key factor for living a healthy, happy life. The earlier we start looking after the health of our eyes, the better is the chance of maintaining good vision throughout our lives. Vision problems can occur at any age, which is why regular eye examinations by ophthalmologists are important. Glaucoma is a group of eye conditions that damage the optic nerve, which is vital for good vision. It is one of the leading causes of irreversible blindness. Medicircle is conducting an awareness series on glaucoma with the eminent doctors to boost awareness and educate people about eye health. Hi, this is Amrita Priya, and you are watching Medicircle. Today we have on our show Dr. Ryan DSouza. Welcome, Dr. Ryan DSouza, to the show.
Thank you for having me here, Amrita. Nice to be here.
So Dr. Ryan DSouza is the Chief Eye Surgeon and Medical Director at Center for Eye Diagnostics and Surgery, Mumbai. He is a self-motivated and enterprising eye surgeon who is also associated with Leelavati Hospital and Medical Research Center as a consultant. He has been associated with Holy Family Hospital in the past. Dr. Ryan always looks forward to stay on the cutting edge of technology and combines the worlds of medicine and technology to provide optimal state-of-the-art and quality care to patients. Dr. DSouza, the first question that we would be discussing today is, who is at the risk of developing glaucoma? And does aging increase the chances of glaucoma?
So, anybody is at risk to develop glaucoma, Amrita. However, there are certain factors that make one more prone to glaucoma. As you rightly said, age is an important factor. The risk of glaucoma typically increases after the age of 40.
Okay.
So there are forms of childhood glaucomas as well. These are relatively uncommon compared to your adult glaucomas. There are various other factors. One of the most important factor is genetic predisposition. So people with a family history of glaucoma are more likely to develop glaucoma than those without a family history.
Okay.
There are other less common factors like smoking, hypertension. Race is also known to be one of the factors. Glaucoma is more prevalent in certain African races,
okay,
and certain other races as well. So if I were to sum this up, I would say one of the most important factors for glaucoma is genetic predisposition and family history.
Okay. So is glaucoma preventable?
Glaucoma is preventable, yes. So I'd like to answer this in a different way. You cannot prevent the onset of glaucoma if there is a genetic predisposition to glaucoma. You may not be able to prevent the progression of glaucoma. However, with timely monitoring and timely diagnosis, you can certainly slow down the progression of glaucoma, and you can prevent the blinding complications of glaucoma. So while glaucoma may not strictly be a completely preventable disease or a curable disease, you can certainly reduce the risks of developing blinding complications from glaucoma.
Okay. So, and is there a cure for glaucoma? Because people say that it's a myth that glaucoma is curable.
Right. No, so glaucoma is not curable. So glaucoma is one of those diseases, like so many others, which can be managed very well, but you cannot cure glaucoma, which means effectively once a patient has glaucoma, you are ideally a patient of glaucoma for life. What this means is regular monitoring, regular follow-up will be necessary. Glaucoma can be managed very well with either medications, lasers, and surgery. There are a number of modalities of treatment for glaucoma. But like I said earlier, you can manage glaucoma very well. You can prevent the blinding complications of glaucoma. So not everybody with glaucoma needs to lose their eyesight or go blind. With correct diagnosis, with timely treatment, timely management, and regular follow-up, most patients of glaucoma can continue to live very normal lives with healthy vision and need not lose their vision to glaucoma. So yes, while glaucoma is not preventable, the blinding aftermath of glaucoma is most certainly preventable.
Okay. So coming to our last question, what factors cause blindness in case of glaucoma?
Okay, so blindness, primarily glaucoma is a disease of the optic nerve. And there are various identifiable risk factors that cause a certain type, a typical structural and functional damage to the optic nerve in glaucoma. So while most lay people associate glaucoma typically with high pressure inside the eye, glaucoma is not just a disease of pressure in the eye. It is actually a spectrum of disease. You see one end of glaucoma where you have normal pressure or even low pressure causing damage to the optic nerve. And you see the other end of glaucoma where you may have high pressure, but you may not have damage to the optic nerve. And right in between, you see the classic glaucoma where there is increased eye pressure with progressive damage to the optic nerve. So glaucoma is not one single disease. It is an entity. It is a spectrum of diseases. And while eye pressure is one of the single most important identifiable and modifiable factors in glaucoma, the real damage, the real risk of glaucoma comes from structural damage to the optic nerve, resulting in functional loss of vision. So there are various things that can cause this. The most important thing that I would like to stress for your viewers is unfortunately compliance issues. So what happens is glaucoma is a silent disease. It's known as the silent thief of sight. So unfortunately, in the early phases of glaucoma, where the glaucoma can actually be managed effectively, most people are not even aware of this. They're not even aware that they have a problem because it's completely silent, completely painless, and asymptomatic in most cases. So the awareness, people should be aware that after a certain age, especially those who have risk factors like family history and smoking, etc., should visit their eye doctors to have routine eye checks done. During these routine eye checks, we look for the presence of glaucoma or the likelihood of developing glaucoma in an individual. Now, if glaucoma is identified at an early stage where structural damage to the optic nerve has not yet happened, it is much more easier to control and to manage the long-term effects of this disease. So the second thing is compliance. So I've seen over 20 years of my practice, I have seen the biggest problem and the biggest challenge we face is, since it's a painless asymptomatic disease, most patients initially follow up, they take their drops, but after some point of time, a lot of people start getting irregular with their follow-ups or missing out on their drops. And because of these compliance issues, unfortunately, a lot of cases progress and a lot of people lose their vision, which is needless. I mean, they need not have lost their vision. So I think if we can increase awareness about the fact that glaucoma is silent and glaucoma needs compliance, I think a lot of blindness can be prevented. I think with that kind of awareness, a lot of preventable blindness, a lot of people can continue to enjoy healthy vision. And it's a complete myth. You know, people believe that glaucoma means I'm blind, I've lost my eyesight, or I'm going to go blind. Most glaucomas can be managed well, and most glaucoma patients can live an absolutely normal and healthy life if only they understand how to manage glaucoma correctly. And the good news about glaucoma is, with modern generation of medications that are available, the need for surgeries in glaucoma have significantly come down compared to 2 decades earlier. So when we were students, most patients of glaucoma required surgery. But today, with the developments in pharmaceuticals, glaucoma can be managed very, very well with medicines alone, and very few patients actually need surgical procedures to manage their glaucomas.
Yeah, the only thing is that even people staying in urban areas are also not so aware, because
I with you. Unfortunately, as far as the eye is concerned, most people only know cataract, and very few people
Yes,
know beyond as a disease of the eye, So yes,
yes.
cataract is most common causes of preventable blindness, but there are so many other silent diseases or lesser known diseases which can actually, if awareness is there, I think people can actually, you can save a lot of vision.
So thank you so much, Dr. D'Souza, for your response. And I'm sure it is going to create awareness amongst people, because what we are observing is that awareness is lacking in people. And probably
True.
this is why something which can be stopped is not being able to, because of the lack of understanding in people.